All right. That's my cue. Welcome, welcome. I hope everyone is having a great day at Connections so far. I am so excited for you to be joining us at Say Goodbye to Generic Healthcare Marketing today. My name is Alyssa Halcomb. I'm the provider marketing lead here at Salesforce. What you don't probably know about me is I came from marketing for an academic medical center, and I did their specialty care marketing, and breast cancer was actually one of my service lines, so you'll see that in here today. But this topic is very near and dear to my heart. You can tune in using live session audio if you want. I think that's mostly for people standing outside of the confines, but feel free to do that in the app. Just a little love letter from our lawyers. If you've been to a Salesforce presentation, you've probably seen this. It's our forward-looking statement. It's just a reminder to make your purchasing decisions based on products that are currently available. And as we always do at Salesforce, I want to start by saying thank you. I know there are a million other sessions you could have attended at this same time, so thanks for coming to this one. I'm so glad to have you. We always use the term in marketing. I know I have. It's okay, we're not saving lives. But in this particular instance, in healthcare, we actually are saving lives. You could be maybe hitting a patient and getting communication to them at the time where they just got diagnosed with a chronic condition and they're trying to figure out how to manage it. You could be sending them a reminder to get a screening that saves them from a late-stage cancer diagnosis. So these things really are life-saving. So thanks for your commitment to your patients and communities. Okay, so let's talk about this. Patients are expecting more and more, but their providers are stretched pretty thin. And let's talk about what that means. I think we all probably use Spotify or Uber or Netflix. So Spotify, for example, they have a DJ curated for me. I'm not sure if you've used it, but it's a great feature if you just like to turn something on and not pay attention to it. But it knows exactly what I want to listen to. It's kind of wild. And then also similar, Uber knows my drop-off location pretty much before I even pick up my phone and open the app. And Netflix knows what I want to binge next. So these experiences are so familiar to us, and they're not as familiar to us in healthcare. So we want those personalized, predictive experiences from our providers, the same ones we're getting from everywhere else. We want it on demand on the channels that we want. We want it fast and relevant, and we want the human touch. We want it to be empathetic and convenient. And on the other hand, providers are facing siloed data and disconnected systems, manual resources that are draining manual resource draining workflows and overwhelmed care teams, which is all leading to staff burnout and limited capacity. So let's talk about why generic marketing falls flat. So we all have a word for this. It's either batch and blast, spray and pray, throw something at the wall, hope it sticks. But this visual is pretty spot on, right? You're actually giving a message to everyone, but no one is actually listening to you. And that's because you might be sending the same message to every single patient or a generic message to a large group of patients, and it's not actually resonating with them. And you might be pulling from static lists. I see some of you trying to avoid eye contact. I know that there are some of you that have been pulling data from the same Excel sheet for like years. And that slows segmentation. It's causing patients to not be as engaged and opting out of those emails that could be helpful to them. So what does personalized marketing look like? It looks like a journey tailored to a patient's exact condition, their behavior, or what stage they're at in the journey. It's driven by real-time data pulled from all your different sources, clinical and non-clinical, and it leads to higher patient trust and even action and loyalty. So I want to talk about the two distinctions here. So we have clinical data and we have non-clinical data, and you can't really truly personalize unless you bring the two together. So you have the clinical data coming from your EHR, which are your diagnoses, your screenings, your appointments, and you have all the non-clinical data coming from your CRM. So that could be communication preferences. What channel do they want to be communicated on? What time of day? You have any contact center interactions that they may have had with an agent that you don't have information in your EHR to view. And marketing engagement. So anywhere they would have engaged with you online. And to truly be able to resonate and send a message to the patients that resonates with them, you have to bring these two things together. It's absolutely critical. So Agentforce is our solution to hopefully fix all of this. So we have brought a list of use cases, I'll show you in just a second, to help you agentify your outreach and acquisition to patients. And we have kind of a crawl, walk, and run strategy that you can see. And really, we are hoping that this equates to lower acquisition costs, higher patient conversion rates, increased marketing efficiency, and improved patient retention. This is kind of a laundry list, but I wanted to show it. I know that the text is really small, but it'll be included on the slides that you'll get in this presentation. But I wanted to kind of show you what's possible. View this as a menu. This isn't everything you can do, but it's a good start. So if you're thinking about patient acquisition and saying, where do I start with AI? Where do I start with Agentforce? Take a look at this list. You might not get to all of them immediately. You might not even get to all of them in a year. You might just be experimenting with AI and not ready to implement anything yet. But when you're ready, take a look at this list to kind of help inform what decisions that you want to make. So being one of my service lines, like I told you earlier, was breast cancer in oncology, and I wanted to kind of show you what an Agentforce journey would look like in terms of a breast cancer patient. So we have Claire. She's a 39-year-old working mom. She's a wellness enthusiast, obsessed with personal wellness brands, but she hasn't seen a doctor in 3 years. She's getting all of her information from Dr. Google, probably. So she's winding down for the night, scrolling on Facebook, and she sees a display ad that says turning 40, and she's like, that's creepy, how'd you know that? So she clicks on it and clicks through to the website and ends up interacting with an agent. And the agent says, hey, I saw you're turning 40 soon, congrats. We are recommending regular mammograms starting now at your age. Do you want me to get you scheduled for one? And she says, yes, that would be awesome. And they said, let me know a few details. So she gives them all the details, and she gets a email. That's her preferred channel, which she told the agent, and to schedule her appointment. So Claire schedules her appointment based on a convenient screening location near her, which the agent helps her with. So let's move on to what a known patient would look like. So we have Olivia. Olivia's a 48-year-old working mom. She's an existing patient, but she's had mammograms in the past, but not in the last 3+ years. So we pull her EHR data using Data Cloud, and I have the segmentation details down there for you too, so you can see it. And we re-engage her because we know she has not had a mammogram. She's late on getting scheduled. So we say, Olivia, are you ready to schedule your mammogram? And so she clicks on it. She said, yes, ready to schedule my mammogram. And she forgets about it. She gets busy. She's a busy mom, working mom. So later she is trying to find a recipe for dinner. And she comes across this display ad on her favorite cooking website. And it says, mammograms, early cancer detection is a lifesaver. And she says, oh, I forgot to finish scheduling my mammogram. So she goes back to the Makana website. She clicks on that, picks right back up where she left off with that agent. They say, hey, Olivia, it's been a while since you've had a mammogram. Do you want me to find an appointment near you? She says yes, and they send her to her portal to make a mammogram appointment, all through Agentforce. And I have a special guest here with me. He's not just going to tell you how this is done. He's actually going to show you how they're using this at U Chicago and what their plans are for Agentforce and how they're able to transform their marketing to be truly more personalized. So, Blaze, off to you.
Thanks, Alyssa. Can everybody hear me okay? All right, sounds good. I won't talk a lot about my background, but what I will say is that I've done 2 implementations of Data Cloud and Salesforce implementations in general. And well, as you can see in my headshot here, after the second one went live, I woke up and I was just a grizzled veteran, and I had this creepy mustache, and things were, they could be better. But what I will say is there was a lot of learnings that I brought from the first time around to the second, and it felt a lot better the second time around, and I'm here to share that with you. So I work for U Chicago Medicine, which is a not-for-profit academic medical health system, and it's based out of Chicago, which is nice because we have a bit of a home field advantage today. So there's a before and an after. The implementation that we went through, we implemented Health Cloud, Marketing Cloud, and Data Cloud. And prior to doing that, we were dealing with a situation where we're using fragmented data sets and outdated lists. To be honest, like something that I saw in that is that the data that we're using in these lists were being pulled by different people. And sometimes there's lack of consistency. And they also die out sometimes. Like if you have a list that's 3 months old, the people that are in that list may not be in the same situation anymore. So the aftermath of this, after we're live, we have a unified patient profile and connected data so that we know this now. Before, we had no real-time insight into our patients, and we're sending them emails that may no longer be relevant to them in the time and place. And that was a little weak, but that's what we were doing. Now we have real-time segmentation. It hits them in the time and the place with the right message, in their right frame of mind when they need help or when they need the message that's coming to them. We're using real-time segmentation, automation for our segments. That's moving from Data Cloud to Marketing Cloud. And that's really important because it does make it relevant, and it really does get in the reader's mind, in the patient's mind. Additionally, we had marketing that was very siloed from our clinical operations. Sometimes we were doing emails that are driving into an experience that operationally wasn't even sound, or that the physicians didn't fully agree with or vet. The aftermath of this is that we built a process with the help of Slalom, our implementation partner. Love those guys, by the way. If you ever get a chance to hire them, I say double down. But we made this process, and it allows us to really scale our segmentation. But what it also allowed us to do is take the time to get in front of physicians, take the time to make sure that operationally what we're doing is sound. And by doing that with a bit of a roadmap and more of like a long-term strategy, it allowed us to be going into market with campaigns that actually make sense, that are possible, that are not driving to a dead end and a wall. And then finally, we had limited ability to measure what works. Like using email reporting that just shows open rates, like let's be real about that. That's almost not even a real metric anymore. Some people use it, some people laugh at it. I'm not really sure what the deal is, but they should probably let go. At this point though, we're scalable, but we're also measuring our journey and driving impact. So back to the platforms that we implemented. All at once, we implemented Data Cloud, Marketing Cloud, and Health Cloud. And so basically we have our EHR, Epic, and that's pushing data into Health Cloud that sits over our Access Center. From there, we're sharing the data from Health Cloud into Data Cloud, where we're building smart segmentation and automation. That passes over to Marketing Cloud as well, but we're also using Data Cloud to activate directly to advertising campaigns in the trade desk and doing programmatic ad campaigns. And then from there, we're also using Marketing Cloud, and from that, we're doing journeys, email, personalization on the web. So this is an exciting time for us. We've been live for 6 months, by the way. That's like the time frame of what we're dealing with. Also, some context is the fact that it's difficult to goal a department that's building one of these platforms. Like, what do you goal them on when you're very early and in an infant state? And so we were actually goaled to hit 100 segments within a year. Our implementation slid a little bit, and so the timeline that we had just kept getting crunched. The days keep going by. When we went live, we only had a few segments live. And at this point, by the end of the month, we need to hit 100 segments and 45 journeys. And as of today, we're at 81. We're going to hit this goal, and it's great. But it also changed the way that we went about doing this. We're really aiming for scale, and we're trying to hit this number because that's what we were told to deliver. And our team and everyone involved is loving the fact that at the end of the month, we're going to tell them that we hit 100, and it's going to feel great. I'm sure it'll just be another day at the office, but you know how that goes. The other part that we're doing is we're measuring our success. And the first time I worked on a project that was similar to this, we didn't have a dashboard. We assumed that it would all be ready and you can just do the reporting that you need to. But a learning from the first time that we definitely kept in mind for the second is building a dashboard that shows performance based on revenue and ROI, because that's the bottom line. We need to back into a goal. The last time I did this, really just trying to set it live. And that's what I thought the goal was. 2 days before we went live, my boss, Andy Chang, says, so when are you going to measure the ROI? Like, they're going to ask for the report next week. I'm like, next week? Yeah, I'm like trying to hit the deadline. And this time around, though, we got out in front of it. And with the help of Laura Olson from Slalom, big call out, she's probably embarrassed, but she built a very impressive dashboard that we're using. And as a result, we can show you how much money we've made in the 6 months we've been live. I mean, if anybody wants to buy a Lambo or two, I guess you could probably do that. But then additionally, we can see how many bookings are coming from our campaigns. And that is most important because it allows us to optimize what's working and learn from what's not. So the big question, what's next? Number one, we're launching Agentforce. Like I said, there's always the next goal on top of the current goal when you're just trying to close the gap. But we're very excited about it. And it is exciting, and seeing everything people are speaking about AI and Agentforce, like this is the future, and we are doubling down in that. We're building and launching 7 initial use cases. And that 7 in those use cases are actually, they're being built based on the fact that they're the top 7 use cases in the Access Center that are holding down 63% of our total call volume. And so if we can actually execute those, it would work wonders for our staffing, but also the effective nature of booking appointments. And then we're not going to forget about what we're doing now. It's not just on to the next product. It's also continuing to refine what we're doing in Data Cloud and Marketing Cloud. We're going to continue scaling service line marketing with omni-channel patient approach. And it'll be part of Agentforce, but we'll also continue to focus on what we're doing in Data Cloud and Marketing Cloud alike for a holistic offering.
Okay. I have a few questions for you after that. So I would like to know, we talk a lot about data, and you have to have your data ready for AI is a thing everyone's shouting from the rooftops. You obviously have to have your data in the best place to be able to personalize outreach to. So tell me about some of your data pitfalls that are really surprising you.
Well, it's interesting. You can buy a platform, and until you go through your data set and know what you're actually dealing with, it's difficult to know what's possible. And this time around, one thing that sticks out to me is I see it in my nightmares, actually, sometimes. There's this basic data set or a data element that is the connection between a parent and a child. And going into this, we're building like top of mind use cases, and we're all talking about all these peds child use cases, which is like 50% of what we're hearing coming in from physicians as well. And I'm thinking to myself, we have half of these in the bag. They're fairly simple or straightforward. When we looked under the hood and found out the state of this data element, what we saw is the fact that it doesn't really exist. And there wasn't a way to connect a parent to their child that you can actually take as a data element and then know who to contact. And that baffled me, and it also made it so that those use cases were not simple, and they're about a 3-month heavy lift. Not that we're going to accomplish it, and we're working through that as we speak, but it's something that you never really know where the pitfalls are until you start turning over the rocks. And you can say that you have this set of use cases that you're going to do and accomplish, and everything's going to be great, but there needs to be a phase 0 data exploratory that goes into those segments that you're planning for. And that idea that you have an idea that seems simple and it just should be in the bag, that's the one for me that is just shocking.
Sounds like you guys have figured out a lot along the way. You've implemented Salesforce your fair share of times. So I want to leave everyone in the room with this. What is one piece of advice that you would offer for someone maybe just starting out or early in their journey? This could be pertaining to AI or just their Salesforce implementation in general.
I think the most important thing to me is that it's never done. And I kept thinking going into this that it's the deadline that's important. It's this set of use cases. It's the new product. It's whatever we're marching toward. I learned that imperfection is something that's part of this, and it's never over. And when you hit what you think is the deadline, there's the journey beyond it. And the only advice I would give is that keep that in mind, and that like it's never going to be perfect. The other part is this type of project, this type of work isn't for people that just expect to nail the landing. Like there's shifting, there's correcting, and what I've learned is to fail fast and then make what you come back with twice as strong, and that's as important as doing like vanilla use cases that aren't risky. But that's, I think those two things are probably the most important to me.
I love it. Good words of wisdom. Well, so good catching up with you. Can't wait to
Likewise.
see what you guys do with Agentforce. And with that, I think we are out of time. So feedback's a gift. Make sure you give us your feedback on this session. And as always, thank you. Enjoy the rest of your day at Connections.
Thank you.